Good morning, Montserrat, and those joining us from the diaspora. I'm Penny Maloney, the Health Promotion Coordinator, and this morning we are live from St. John's Clinic, where we will be kicking off our Pfizer-BioNTech vaccination against COVID-19. And we're going to start this morning with the booster shots, and we have a contingent here this morning to share their booster shot journey live with you. We have His Excellency, our Governor, Andrew Pearce. We have the Honorable Premier, Mr. Easton Taylor Farrell, as well as some ministers of government. The ministers include the Honorable Minister of Education, Health and Social Services, Mr. Charles Kernan, and the Honorable Minister of Communication, Works, Labor, and Energy, Dr. Samuel Joseph. And just to let you, our listening audience, know, Pfizer-BioNTech vaccine, the brand name is Comirnaty, and we are continuing with AstraZeneca as we did before, but we are adding this new vaccine to our campaign. The vaccine is available for persons over the age of 12, so parents, you can allow your children to get this vaccine. It is safe for pregnant women, for breastfeeding women, and it is compatible with the AstraZeneca vaccine as a booster dose. We have over 600 persons registered thus far, but there's still room for you to register for your vaccine. Just to let you know, registration is quite simple. All you have to do is contact the St. John's Clinic, 491-5218, and be prepared to give them just a little bit of information, your name, your contact number, your current vaccination status, and you can get registered. We're going to begin now with the Premier, the Honorable Premier. Yes, and he's going to share with us before he sits down how he feels this morning.
I am very excited because I think that it is important that the population is fully vaccinated. And I say fully because we know that some of us have had our 2 shots already. But the science is showing that we need a booster. And I'm very comfortable taking my booster. Just to, I lead by example, if you want to put it that way. And I would also encourage all persons who have already taken their 2 shots to come in and get their booster. It's very important. Important for us, and as a leader, for me to get this country moving forward, it's important that we increase the percentage of the population who are fully vaccinated. And that is why I'm here this morning to take my
Yes.
booster.
So thank you for coming in and being the first person. And just to let persons know, when you come, it's going to be a very simple process. There's a short form that you fill out. It's a general health and wellness form where they ask for simple information such as your medical history, any allergies, if you have any medical conditions such as hypertension, diabetes, heart disease. Very quick, very easy. And once you fill that out and the nurses assess your readiness for vaccination, you'll enter the vaccine room and you're going to see now how quick and easy this process is. So you can go ahead and have a seat, Premier. And we're waiting now for our EPI manager. That is the Extended Program on Immunization Manager, Nurse Violet Brown, and she will be administering the booster dose to our Premier this morning. And just to inform you, I know persons have reservations about why a booster shot. Now, a booster shot of a vaccine is not something that's unusual. It's a common practice in immunization. And what the scientists have found throughout the many, many years of vaccination is that sometimes immunity dips just a little bit. And to boost your immunity back to full capacity, you have to administer a booster shot. So let's look at tetanus, for example. We've all been vaccinated against tetanus, and we would have had multiple shots throughout our life course. In fact, every April, when it is vaccination week in the Americas, the nurses go out into the community and they give booster shots to our general population. So this is not an unusual thing. It is common practice. It's just that we're living in history at this moment where we are seeing things happening live and getting an understanding and an appreciation of what happens with immunization and vaccination. So as you can see, our nurses are preparing themselves, hands have been washed, gloves are being applied, and the vaccine is being prepared. And as with the AstraZeneca, it will be administered into the arm, the upper arm, into the muscle. It's a very quick process. It's a relatively painless process. I know some of us, we have nerves when we see the needle, but really and truly, it's not as bad as you imagine it to be. And side effects, you can expect some side effects. Some people do experience side effects, but they are generally mild and self-limiting. So we're talking things like maybe a mild temperature, a feeling of lethargy, you're tired, you're feeling a little bit weak. Some persons start to feel a little bit like they're catching a flu. But as I mentioned, it's self-limiting, and within a day or two, you're up on your feet, ready to go, and your immunity against COVID-19 is boosted. I know there are concerns from the public about the Omicron variant and its responsiveness to vaccination. And this is where booster shots are important, because what the current data is showing is that while the 2-dose is not as effective, Omicron can evade that. A booster dose is helpful against Omicron. And while we are concerned about Omicron, I just want to say that Delta remains the prevailing strain that we are immunizing against, and we know for sure that 2 doses of a vaccine protects you against severe illness, hospitalization, and death. And as you can see now, the needle into the upper arm. And just like that, the process is over. And the Premier, to his credit, he did not even flinch. Can you tell us how it felt? Was it overly painful?
Not really. There's nothing. You have no feelings. Just that you know, it's a normal injection, I believe. I haven't felt anything different.
Okay, so he hasn't felt anything different, and maybe he can report back to us how you feel tomorrow in terms of side effects. Some persons, when they get a booster shot, they actually don't get any side effects at all. However, remember, most of us, we would have had our AstraZeneca vaccine. And what the data shows is that after you have that 2-dose AstraZeneca and you now introduce the Pfizer, some persons are reporting that they do get that little vaccine illness again, where again, some persons have pain in the upper arm, they feel a little bit weak and tired, some persons experience fever. There is a major side effect that we do have to look out for, but it's very, very rare, and that is inflammation of the heart. And one of the things that persons are advised to monitor: are you having chest palpitations? Are you feeling short of breath? Are you having pain in your chest? And if that's the case, you need to seek medical attention immediately. And that's a rare side effect. And just to let you know, not only is it rare, but they have not been deaths. Persons have generally recovered, and there have been very few deaths from that side effect. So thank you, Premier, for being our first. And you have a good day. And we are now going to see the vaccination of His Excellency, the Governor, Mr. Andrew Pearce. So while we wait for the governor to come and have his vaccine, again, I just want to say the registration process, it's very, very simple. You contact the St. John's Health Center. The number is 491-5218. Someone at the desk will take your information, your name, your contact number, and your current vaccination status. Parents, you can register children over the age of 12 to be vaccinated, and the vaccine is safe for pregnant women, breastfeeding women, so you can also register for vaccination. We now have the governor with us. Good morning.
Morning.
How are you feeling this morning?
Yeah, pretty chipper so far.
Okay, so he's feeling good, just like our premier was. And again, it's going to be a very quick and simple process. We see our nurses once again. They are pulling up a dose of the vaccine. Just to inform, 1 vial of the vaccine can vaccinate 6 individuals. So for today, we have 18 persons, 3 vials. So 18 persons will be coming in and getting their booster doses of the Pfizer vaccine this morning. And registration really is important because of the number of persons that can be vaccinated per vial. We do not want wastage. So each time the nurses open a vial, they have to ensure that they've got 6 persons registered and ready to get their vaccine that moment. We also know that vaccines are very temperature sensitive, so there's a limited window of opportunity. So there's no walking in to just get this vaccine. You really do need to make the effort to get registered. And there we have it again, quick, easy, simple. So would you like to say a few words to our audience this morning about vaccination and the importance of it?
I would please. No, thank you very much indeed. Thanks, colleagues in the media, for coming along this morning. I mean, firstly, I just wanted to say a real thank you again to all the staff at the Ministry of Health. They've done a fantastic job keeping us all on the island safe, and this morning is another example of their swift, smooth and professional handling of these vaccination and counter-COVID issues. So I'm really grateful to them, and I know all of us on the island are. That was a very quick and painless vaccination, I must say there. And then on the COVID front itself, I just wanted to make a couple of points. It's been nearly 2 years fighting COVID here on the island, and Montserrat has done really well. There's no doubt about that. We have, I think, had 45 cases only, which is a very small number, and by and large we've been able to maintain a life on the island that's relatively unscathed, if I can put it that way, from COVID. And that's thanks particularly to the Ministry of Health, but to all our frontline officials and to the island itself. So that's a very good sort of background situation. But Omicron, the new variant, really is shifting the dial. It's changing the threat for us and for the whole world. The rate of spread of Omicron is incredible. We're looking at now 100,000 cases a day in the UK, and it's exploding in a similar way basically in 70, 80 other countries. So it represents a qualitatively different threat for us. So far it's not clear, it's been around only such a relatively short time, it's not clear whether it's going to be more lethal or have more severe symptoms. The jury is out on that. But we do know it's very, very much more infectious, and the load that that's going to put on our hospitals and medical services is enormous. And the way to deal with Omicron, the way to fight it, so far what we're seeing is, if you've already been vaccinated, is a booster. A booster makes an enormous difference. If you've been vaccinated 6, 7, 8 months ago, the main vaccines, their efficacy against Omicron, against infection, declines quite substantially. It may well be that the vaccines are still reasonably effective against hospitalization and death, but against infection they're not so effective. Boosters do the job. Boosters put it right up to 75, 80% effectiveness. A Pfizer booster like today for somebody who's been AZ vaccinated. So the first point I wanted to make is a plea to all of us. Please, those of us who've been vaccinated on island, please do get the booster. It's quick, painless and efficient, and it will make all the difference to you, your family and the whole island. The second point is that if you've not been vaccinated, I appreciate that everyone has their own perspectives on these issues, and nobody wants to force people to believe in things that they don't. But please can I ask that those of you who are not vaccinated listen to the advice of the experts, the WHO, PAHO, the UK, EU and US medical authorities, and our own medical authorities here, of course. All are experts. They're not armchair folks. They're not people commenting down the pub or on social media with no knowledge. These are experts who spent their lives doing this, and they are all, to a man and woman, recommending, urging people to take the booster and get vaccinated. So I would ask, please listen to that, because as we go into the next year, if we're going to really beat this scourge and bring back a way of life for ourselves which is more comfortable and balanced, the key is vaccination. So please do reflect on that, and don't be distracted by, you know, the scare stories and the fake stories.
Thank you very much. Okay, so we are now going to have the Minister of Health and Social Services as well as Education, Mr. Charles Kernan, and he will be coming in to have his vaccines. Yeah, so we've been talking a lot about boosters this morning. However, just to really, hit the point home, it's not just boosters that this vaccine is available for. We do have first doses. So if you haven't yet been vaccinated and you would like to have the Pfizer vaccine, you can also register. It isn't just about boosters only. And again, registration, very simple. You call, you put your number down, you give your name, and the nurses will call you to schedule your first dose or booster. And again, who can get this vaccine? Children over the age of 12, pregnant women, breastfeeding women, all of us in the general population, we are eligible to be vaccinated. And I know that we're pushing vaccines quite heavy because we do know the benefits of vaccines. But of course, we're not going to negate your personal responsibility to keep yourself safe by mask wearing out in public, following our quarantine restrictions. So persons who are in quarantine, you need to remain in quarantine. Those not, you don't want to be fraternizing with those who are. We also want to maintain our social distancing as much as we can. And I like to say at this time, we cannot trust a sniffle or a cough. So if you're feeling unwell, you do need to contact either your private doctor, the St. John's Health Center, any health center, or even the casualty department to make sure that you can be checked out to ensure that you are, in fact, not carrying the COVID-19 virus. Good morning. How are you this morning?
I'm well.
You're well.
You asked a question, I'm well.
He's well. So now again, you're going to see how simple it is, how easy it is. And as I mentioned, we do have a contingent this morning, and it includes the Minister of Health. We also have the Minister of Communications, Works, Labor, and Energy, Dr. Samuel Joseph. You've already seen His Excellency, the Governor, Mr. Andrew Pearce, as well as our Premier, the Honorable Eastern Taylor Farrell. All done? Quick and easy. Okay, so the nurse says she's going to check for any bleeding. I don't think much is expected. We just see a little pinprick of blood there, and he's good to go. And I know that there were some concerns about glove wearing, so just to, again, inform that gloves are not always necessary for vaccination. It's not part of the protocol. Clean hands are, and as you would have seen at the beginning, the nurse washed her hands, and she washed her hands throughout the process as well. And that's it from us this morning here at St. John's Center. Again, Pfizer, BioNTech. The brand name is Comirnaty. It's safe, it's effective. Booster shots are available as well as first doses. I have to emphasize that, first doses. So if you've had a first dose of AstraZeneca, we can't give you a second dose of Pfizer. We can give you a second dose of AstraZeneca and follow up 6 months down the line with your booster dose of Pfizer. But you can register for your first dose as well as your booster shot of the Pfizer vaccine. 3 months. Our boosters are starting at 3 months. The nurses have just informed. So if you've had your second AstraZeneca dose at least 3 months ago, you are eligible for your dose. With that, I'll say goodbye. Once again, you've been joining us here live from St. John's Center. I am Penny Maloney, and it's been a pleasure chatting with you this morning. And do enjoy the rest of your day and have a safe and happy holiday season.